The Trump administration is rolling back COVID-19 vaccine recommendations. Health Secretary Robert F. Kennedy Jr. says the CDC will no longer recommend routine COVID vaccines for healthy children and pregnant women. The changes mean COVID shots may not be fully covered by insurance companies. The CDC advisory panel is set to meet in June to make recommendations on fall COVID shots. Those advisors had already been weighing whether to narrow the agency's guidelines. However, Kennedy's move now shortcuts that process. A new study appears to show mothers' physical and mental health is on the decline. Now, these numbers are self-reported by mothers in 2016 and 2023, but they tell a story. The number of mothers reporting excellent mental health dropped from more than 38% to 26%. And while the decrease in physical health isn't as stark, there is still a downward trend. Let's bring in Dr. Lindsay Admon now. She is an associate professor of obstetrics and gynecology at the University of Michigan and is the senior author of this study. Good morning, Dr. Admon. Great to have you with us, but I wish it was, on more encouraging headlines. We know that the pandemic was especially tough on mums out there, but it looks like this drop started before COVID hit. So why do we think that is?
Exactly, Errol. We found this really dramatic decline in maternal, particularly maternal mental health over the last decade. And our findings indicate that this trend, this downward decline in maternal mental health really predated the pandemic. The pandemic certainly might have given the decline a boost, but is not the only contributing factor.
So what was bringing mothers down?
It's hard to know, and I think we need more research to fully understand. There are certainly factors that have increasingly contributed to adverse maternal mental health over the last decade, including inflation, rising costs of childcare, lack of parental leave in the United States, and those things are all things we really need to work on, I think.
And it should also be noted that you saw a decline in all groups of mothers, but I'm curious which groups reported the lowest mental health ratings.
Thanks, Errol. You're right. While declines were identified among all groups, the lowest ratings of maternal mental health were identified among mothers reporting lower levels of educational attainment, single moms, and those whose children were on Medicaid or uninsured. And I really think this is concerning because our findings suggest that mothers most likely to be insured by Medicaid may have the worst maternal health. And this is important because Medicaid funds nearly half of the approximately 4 million births per year in the United States. And many moms remain on Medicaid as low-income parents. Certainly, proposed cuts to state Medicaid programs are concerning as they will likely impact access to mental health care for millions of American moms at a time when they may need it the most.
And it sounds counterintuitive as well. You know, we are in the future here. We've got technology, we've got knowledge. You would seem to think that would improve the mental health of mums. What long-term recommendations then do you make in order to address some of the underpinnings of what you're finding?
I think our study really underscores the need for comprehensive research on the health and well-being of moms and really all parents more broadly. We need to urge support for interventions to improve prevention, diagnosis, and treatment of mental health conditions. And we need continued federal funding and access to federal data, which will really be critical to the success of these efforts.
Such an important study. I hope folks listen to what you're finding and recommending. Dr. Lindsay Admon joining us from Ann Arbor, Michigan. Thanks for your time.